And we're back here at CPAC, and I'm with Dr. McCullough. Thank you so much for joining us today.
Thank you.
You were one of the first people who came out and took a different approach to COVID. What happened to you personally?
Yeah, I took the first approach. The first approach was to treat patients based on a combination of drugs with signals of benefit and acceptable safety. And I published that out of the gate quickly. The issue was other doctors didn't follow en masse. And as we look back, we had about 500 doctors basically carry the country carrying for COVID. 1 million doctors literally just let the virus ravage their patients. They ended up hospitalized. We had about 10 million hospitalizations, 1.1 million deaths. About 2/3 of that was completely avoidable with early treatment. So it wasn't that my view was aberrant. I actually had the correct view. Is the fact that doctors, I think, driven out of fear and then a government narrative, basically abandon their patients.
Well, I think the question now, a lot of people are really scared because most of us took the vaccine. We don't know if there was damage to our hearts. How do we know if there's a problem or if we're going to have a problem?
It's true. The CDC says that 92% of Americans have taken a vaccine, that at least one shot, 79% took 2 shots, but only 16% are concurrent with boosters. We know that 2 studies, the rate of heart damage is about 2.5%, but most of the clinical importance of that is in the first 30 days. So after the first 30 days and every month thereafter, the risks progressively go down. The main thing I want people to know is that if they've taken a vaccine, it's been 18 months from now, to understand that the risks are cumulative. Taking more shots is ill-advised at this point in time, and that they should be watchful. You go on a long plane ride, one leg is swollen, think blood clot because you've taken the vaccine. If there's chest pain, trouble breathing, think heart problems because the vaccines cause heart problems, and get prompt attention. I don't think people broadly need detoxification. A lot of people are working on strategies there. But if people remember those principles, they're fine. The Zogby survey last summer said 85% of people who took the vaccine are fine. They're fine. But 15%, which is a huge number, have some new medical problem. On December 7th, 2022, I called in the U.S. Senate to pull all the vaccines off the market. I don't think they're safe for continued use.
Final question. What is the lesson to doctors out there? So many who went along with what the FDA and the CDC said to do, so many doctors that we trusted, and it's really hard to be mad at your doctor, but at the same time, I think we're really frustrated.
Patients love their doctors. We have 1 million doctors in the United States, and we need them. The doctors aren't bad people inherently. They're not. They're my friends, my colleagues. I've been in this business 4 decades now. But doctors need to apologize to their patients for what's happened. If the doctors have failed to treat COVID-19, they need to apologize. If the doctors have supported or promoted these vaccines, they need to apologize quickly and get on the right side of history. This is not going to end up well for the vaccines. I'm telling you, the number of injuries, disabilities, and deaths are far too high. The doctors need to reverse course, pull support for the vaccines, and get unified with their patients.
Dr. McCullough, thank you again. One of the leading voices in this time in history, really. Thank you so much.